Hello. So, today we're going to talk about nursing pathways. All the different pathways in nursing. Nursing is such an expansive field. It's so many areas that you can work in as a nurse. So, if you ever feel like you're not in the right place, there is a lot of other places in nursing that you can try to be. Okay. So, here we go. So the first one I want to talk a bit about, it's medical surgical nursing. So that area, like if a patient has illness that they have to be admitted for, like a chronic illness, or they just had surgery, they may be admitted. They would be placed on the medical surgical floor. So that's an area of nursing, and there's some nurses that's their niche. I have a friend, and she's been doing it like over 20 years, loves it. So you just have to find your niche, like where you fit in, where you feel the most passionate about. So, and this list that I'm going to go through, I am sure I may be missing other areas of nursing. This is just what comes to mind when I think about the different pathways for nursing. Then we have pediatric nursing. That's the baby nursing, the babies, the infant, child. So those nurses, they take care of that niche of patient, those kids. They take care of the kids. They do the kids nursing, as we would say. Then we have the oncology nursing. Those nurses work with just patients who have cancer. And we do have hospitals that are like cancer hospitals, like MD Anderson. So those nurses work just with cancer patient. They may work in different areas of the hospital, but they work with a specialized set of people who have cancer, and they love it. That's their niche. We have the emergency room nursing. That's more like a fast-paced, critical patients, very fast-paced. You're getting patients in quickly, getting them out maybe to another facility, maybe to your facility, to the ICU, maybe to a med-surg unit. But that one, it tends to have like it's very, very fast paced, or they may be discharging the patient to go home. So emergency room it's rather a fast paced setting. And also sometimes some patient comes into the ER, they're so critical, they actually come in, we would say coding, but they actually come in like dying, where they're already given compressions, they're already doing CPR, and sometimes they don't make it out. But the first place of entry that they would come, it's to the emergency room. Now, if they do make it out of that CPR, you know where they're coming next? ICU. Love it, love it, love ICU. So they're gonna come ICU next, and we'll continue the care. All right. So with no further ado, let's talk about critical care nursing. That is my specialty, and I'm passionate about it. Love ICU nursing. I have been in ICU for maybe over 10 years. Love ICU. So in the ICU area, most times we're assigned two patients. If the patients gets very critical, like more critical than what we started off with, sometimes they have to single that assignment, meaning give you just one, because a patient is just really just touch and go. We're just touching and going literally. And so it may get to that stage where it's just one patient that you have nursing, because a patient is just so critical. So in ICU, we tend to spend a bit longer with the critical care patients. They may be there maybe for days, sometimes for months. It just depends on what's happening. So they come in, they're very critical, and until we could get them to uh, a different place, I'm going to say a different place, because the place can be for that patient if they want, if their desire is not to be resuscitated or to transition to a hospice care, palliative care. Their place will be basically dying in the hospital. Then we have those patients who do not recover as we would have wanted them to. So they may pass on also. And then we have those patients. So we do see a lot of deaths sometime in ICU, which can be very, very sad at times. Um, and then we do have those patients who have made a very good recovery and they will now go on to, let's say, on the floor and then to like a rehabilitation facility, and with time, they'll work with occupational therapy and stuff, But ICU nursing, it's critical care nursing, and each of these areas, they do have certifications that come along with it. That after you work in the environment for maybe 2 years, I would recommend at least 2 years, you get to understand it better. Then go ahead and do your certification course. They do have emergency room certification, they do have ICU certification. I do have my critical care registered nurse certification. And it really gives you that extra confidence, that extra. I respect that exam a lot. So I would say after 2 years of being in a specific area, if you're interested, if that's where your interest lies, go ahead and do their certification course. It's normally offered by the different specialties, and you do it normally on the computer. And then once you pass it, this certification makes you more marketable also. So I would say ICU nursing, it's critical care, that's what it is. Then we have neonatal nursing, and these nurses, they work with the neonates, which it's basically those babies, the newborns, the new babies. Yes, and they just work with that particular group of patients. So especially like the premature babies, these nurses would work with those babies. Then we have the nurses who do geriatric nursing. They tend to work with like the older people. You may find them working sometimes in a nursing home or other facilities, and they just work with the older people. We have psychiatric nurses. They have hospitals and rehabilitation facilities that are solely for psychiatry. And you have nurses who work just in a psychiatric facility, or maybe they work in a psychiatric clinic. So they deal with patients who have mental illness and they help them. That's their area. Um, we have travel nursing, and that's what some people do. I've never done it, but I know during COVID, oh my gosh, a lot of my coworkers, they went to do it. Um, they made a lot of money in travel nursing. They went to different states. Some even stayed in the state and just worked in different hospitals for a period of time. It's normally temporary. So they go around to these areas. And some of these nurses, I have a friend, a very good friend who does it. They just don't like to stay permanently sometimes in one area, in one place. So they love that. That's what they love, and that's fine. So they go to these areas maybe sometime for 6 months, sometime for 3 months, sometime for a year, but they know it's temporary, and that normally pays a lot more. Travel nursing, and some people do it and they enjoy these. They go to California, they go to Arizona, they go to different states and just kind of get to enjoy, being in a different state and all that while they're working. And that seems like a lot of fun too. Then we have home health nursing, and these nurses, they come into your home. So they come into your home and take care of you. You may need, maybe they're coming in to give you antibiotics daily for a set amount of time. So they come into the home, they're home health nurses. So they don't work in a hospital setting. They come, their setting is at your home. Yes. And then we have nurse education. Nurse educator is someone who educates the nurses. That's their specialty. So they go ahead, um, they plan different education avenues. Sometimes they basically work like as a consultant. So if the hospital says, we need more education on uh, NG tubes or something like that, then the nurse educator at the facility and you have nurse educators who are specialized. You can have an ICU nurse educator, you can have an ER nurse educator. So that's in the specialty. So you can be a nurse educator and you could just be a general nurse educator, or you could be a ER educator, a ER nurse educator, or ICU nurse educator, or a OR nurse educator. Let me tell you, nursing is filled with specialties. So there's no reason to stay in one area if you're not liking it, if you think that's not for you. There is so many different things to do. Then we have a set of nurses, that's the advanced nurses. So the advanced nurses would be like the nurse practitioner, the APRN, and the nurse practitioner works in terms of like diagnosing patients, treating patients, so almost like a physician, and writing prescription, doing all that stuff, seeing patients. And some of these nurse practitioners, they have their own practice. Sometimes they work with the hospital. So like in my hospital, they in the nights and even in the days, sometimes they have like nurse practitioners along with the physician in the ICU setting. So if you need an order, if something's going wrong with a patient or something is happening, the nurse practitioner is right there. So you have nurse practitioners. Then we also have nurse anesthesists, and those are the CRNAs. They basically, when you have a surgery, those are the ones who would administer the sedation, the anesthetic. Those are the ones. They basically kind of put you to sleep and kind of wake you back up, maintain your airway. And so that's what the nurse anesthetist in a nutshell would do. Um, then we have the certified nurse midwife. So that nurse is someone who would take care of like somebody who is pregnant, somebody after their pregnancy, during their pregnancy, with their labor, delivery, that kind of thing. So that's like what the midwife would do. My mom was a midwife. She was an excellent midwife, and she loved babies. She loved young mothers. Very passionate about what she did. So it's finding your place. Um, and what you like best, and then going into it. Then we have the public health nurse. So the public health nurse, they kind of prevent diseases, promote wellness. They are normally in the community setting. And so we have the public health nurse, and along with the community setting, we also have school nurses. And so all these schools where your kids go to school, if you have kids, they have a nurse at the school. We have to. We need nurses at the school. We have to. So these nurses, if the kids have any ailment, they would go into the nurse. And if the teachers need to go to the nurse, if the staff needs to go to the nurse, there is a nurse there. So we have to have nurses in the schools. You have nurses who work like in the county jail, in the prisons. Yes, you have nurses there too. And there are some nurses who say, that's their niche, and they love it. So we have nurses who just work in the prison system or in the jail system. We also have hospice nursing. Um, Hospice nurses, they basically provide comfort for a patient who's dying. And, I have a nurse friend and she does that. And she said it feels so rewarding to her. For me, I would be like, I don't want to be in a setting where the patients are, I know they're dying like all the time. I I would like some glimmer of hope. I do work sometimes with patients who are dying, but I would like to know that some recovered. Um, but you have nurses who that's their niche, making you comfortable while you're dying. And you will need that. If you have a terminal illness and you're dying, you would need a nurse who just deals specifically with that. So as I said, everybody have their niche with what they like to do. So it's finding what you want to do in your nursing career. Let's look at flight nurses. So these nurses, they tend to be on the airplane. So if someone gets ill on the airplane, so these nurses would travel around a lot. And some nurses like that. I have a friend who does that. They travel to different countries, different states. That seems exciting too, you know. So it would be up to you. I don't want to be in an airplane like all the time. I like traveling, but I'm not sure I want to be on the airplane all the time like that, but they have people who do. So then we have nurses who work in the military. So, yes, 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 you can go as a nurse, you can apply for a job in the military and go off in the military and just take care of the military and their families. Yes, that's another niche. Then we do have also forensic nurses, and those nurses, they help to care for patients who have been the victims of crime, patients who were raped, that kind of thing. Sometimes you'll see them working like in the emergency room when those cases come in, and they work, like say in the emergency room sometimes and they collaborate with the law enforcement officers. They would do those exams, they would talk to the patient who was just who is a victim, I should say, of a crime or something, and they would work with collaborate with law enforcement. So that's another aspect to nursing. Then we have the legal nurses. So those nurses, they work alongside the lawyers and they prepare for court cases. So, all those medical jargon, all those things, they're the ones interpreting it, breaking it down, working with the lawyer, so you can even go into that route, like, and just do legal nursing. Um, then we have um, nurse managers. I hope, even with this list that I'm thinking about, I'm pretty sure I'm missing a lot of different nursing aspects still. That's how wide the nursing field is. So nurse managers. So let's talk about that for a minute. Sometimes, even sometimes you're working on a unit, your co-worker may turn up after a while and be your manager. So the manager is the one who would be running the unit, be in charge of everything on the unit, making sure all the schedule is done like monthly, keeping the unit abreast with everything that they're supposed to be doing. Um, the nurse manager, sometimes, I'm just letting you know, sometimes the nurse manager, if the unit is very short, you may see them come in and helping to pick up a shift, maybe like charging, you know. So the nurse manager is basically in charge of the unit. And that's another aspect of nursing. And with that said, I am sure that is just, I feel like I still may be missing a lot of other aspects of nursing. So if you ever feel like you're not in the right area, and I didn't even touch on like clinic nursing. You have nurses who just work like in a doctor's office, in a clinic setting. Oh, I forgot. You have nurses who are occupational nurses who they work in these companies, like these oil companies, whatever companies are out there. They work as occupational nurses in these facilities. And so they work with these big companies, Yeah, and get all the benefits of those companies. Yes, and that's another aspect of nursing. So that's the occupational. And then you have the employee health nurse, like even at the hospital you're working, you're going to find there's an employee health nurse that deals with just employees. Um, and I'm sure, like I said, I may be missing a lot more nursing, a lot more different types of nursing. Um, because you even have like the every time I'm thinking about it, I'm like the telehealth nurses. They don't see patients face to face. They work like in this building and they support like a couple doctors office, so they'll take incoming calls, give nursing advice, that kind of way. So give messages to physician, so they work basically on the computer, on the phone. I did that for a small part of my career, so it's not face to face. So there is, when you come out into nursing, you can choose if you want to be face to face, or if eventually you want to be like in a setting where you're reviewing medical records, like in an insurance company setting, that kind of way. Or you maybe just want to work like in a small doctor's office, and it's fine. It's finding what you are passionate about, you know while you're in nursing, and then just going out and executing it. But find where you belong. Take your time, look at all the different aspects of nursing, see what you want to do while you're there, see which area you want to branch out into, because it's a lot of different areas. And find what fits you, what feels right for you. Nursing is it's huge. It's huge. And so I just want to encourage you. To look at different types of nursing, when you get in and see what you want to do. You all have a great day. Thank you.